Have you ever felt a strange pressure in your chest? Or caught yourself struggling to breathe after doing something as simple as walking across the room? Maybe you chalked it up to being out of shape. Maybe you told yourself you were just tired or that it was just part of getting older. But what if it wasn't? What if that pressure, that breathlessness, that creeping fatigue? Was your body whispering something urgent? Because when it comes to blocked arteries, what doctors call atherosclerosis, there's rarely a dramatic announcement. No flashing lights. No blaring alarms. Just quiet signals. Subtle shifts in how your body feels. Changes that creep in gradually until one day, they're impossible to ignore. And by then, it might be too late. Blocked arteries are dangerous precisely because they're silent for so long. They develop slowly, often over decades, narrowing the vessels that deliver oxygen-rich blood to your heart, brain, and muscles. And as that space closes off, your body starts sending out distress signals, small, scattered, and easy to dismiss. But dismissing them could cost you everything. So let's break the silence. Let's look at the early warning signs your body might already be giving you, the ones that hint at clogged arteries, even when you feel mostly fine. Let's start with the one most people think they know, but few truly understand. 1. Chest pain, but not always how you'd expect. The classic sign of a heart issue is chest pain. But pain is only part of the story. In reality, it often doesn't feel like pain at all. It can be a tightness, like someone cinching a belt across your chest. A weight, as if someone's sitting on you. A burning that mimics heartburn. Sometimes, it's just a nagging discomfort that spreads to your shoulders, jaw, or back. This sensation, called angina, usually shows up when your heart is working harder, during exercise, heavy meals, emotional stress, or even cold weather. That's when narrowed coronary arteries can't keep up with the heart's demand for oxygen, and it protests. What's dangerous is how variable this can be. Some people feel sharp jabs, others experience nothing more than a strange pressure or fullness. It might last minutes or pass in seconds. If it eases with rest, it could be stable angina. But if it comes on suddenly, gets worse, or strikes while you're doing nothing at all, it could signal an unstable blockage. One step away from a heart attack. 2. Shortness of breath even when you're still. Shortness of breath isn't just a lung issue. In fact, it's one of the most overlooked cardiac symptoms. If you find yourself gasping after light activity or worse, while sitting or lying down, your heart may be struggling to pump blood efficiently. As arteries clog, the heart has to fight harder to deliver oxygen. That struggle leads to blood backing up in the lungs, creating a feeling of breathlessness, sometimes with a sense of suffocation or wheezing. You might notice you're stacking pillows at night, just to sleep. You might avoid stairs because your chest tightens halfway up. This isn't about being out of shape. It's about the oxygen highway getting jammed. 3. Extreme fatigue, the kind that creeps in and stays. We all get tired. But this is different. This is the kind of exhaustion that sleep doesn't fix. The kind where basic activities, brushing your teeth, folding laundry, walking to the mailbox, feel like too much. When arteries are narrowed, your heart needs more effort to do the same job. That robs your muscles, your brain, and your organs of the fuel they need. You're running on fumes. In women especially, profound fatigue can be an early and overlooked warning sign of coronary artery disease. Sometimes it appears days or even weeks before a major cardiac event. Don't wait for chest pain. If you feel drained all the time, pay attention. 4. Leg pain, cramping, or weakness that improves with rest. Pain in your legs while walking, relieved by rest, isn't just aging. It may be a sign of peripheral artery disease, PAD. In PAD, the same kind of plaque that clogs coronary arteries starts to block the vessels in your legs. When you walk, your muscles need more blood. If they can't get it, they cramp and ache. As soon as you stop, the pain fades because demand drops. But over time, the distance gets shorter. What once took a mile to trigger, now takes a block. Eventually, the pain comes even while sitting. Left untreated, PAD can lead to ulcers, infections, and even limb loss. But early intervention can reverse the trend. 5. Nausea, indigestion, and sweating, especially when they don't make sense. Heart symptoms aren't always cardiac in appearance. Sometimes they show up as nausea, a strange sense of fullness after a small meal, a fluttering stomach, or the urge to vomit, especially in women. The heart and the digestive system share nerve pathways. When your heart is in trouble, your brain might interpret it as a stomach issue. That's why heart attacks are sometimes mistaken for indigestion. Add to that a cold sweat, clammy, damp skin without any exertion, and you have a serious red flag. It's your nervous system going haywire in response to cardiac stress. 6. Heart palpitations, or that something isn't right feeling. Palpitations are more than just a racing heart. They can feel like skipped beats, thuds in your chest, or a fluttering sensation in your throat. Sometimes, they're harmless. But frequent palpitations, especially if they're paired with lightheadedness, chest tightness, or fatigue, could point to arrhythmias caused by reduced blood flow to the heart's electrical system. Think of it as static in your body's most vital signal. And just like static, it can disrupt the rhythm, sometimes fatally. 7. High blood pressure that stubbornly stays high. High blood pressure doesn't hurt. But it does damage quietly and relentlessly. When arteries are narrow, the heart has to pump harder to push blood through. That increases pressure. And that pressure causes more damage to artery walls, which invites more plaque, which makes pressure rise again. It's a cycle. And if your blood pressure won't drop despite treatment or lifestyle changes, your doctor may need to look deeper at your arteries themselves. 8. Swelling in the legs, ankles, or feet. If your socks leave deep marks by evening, or your shoes feel tighter than they did in the morning, take notice. Swelling, especially in the lower limbs, is a sign that blood isn't moving efficiently. It's pooling, pulled downward by gravity, and leaking into the surrounding tissues. This is called peripheral edema. It's often the result of heart inefficiency due to narrowed arteries. And if it progresses, it can lead to infections, skin changes, and non-healing sores. 9. Cold, numb, or discolored extremities. When blood flow is compromised, the body prioritizes where it sends it. Vital organs first. Fingers and toes last. If your hands and feet are frequently cold, numb, or tingling, or they look pale or bluish, you may be experiencing poor circulation due to blocked arteries. This is more than discomfort. It's tissue starving for oxygen. In advanced cases, it can lead to gangrene and amputation. So what can you do? Start by listening to the whispers. The signs that something's off. Don't dismiss them. Don't wait for them to become screams. Get evaluated. A stress test, a coronary calcium scan, or a simple ultrasound can detect narrowing before disaster strikes. And most importantly, act early. Through diet, exercise, medication, or medical procedures, you can halt or even reverse plaque buildup. Clogged arteries don't happen overnight. And heart attacks rarely come out of nowhere. Your body is speaking. Are you ready to listen?